Try to decide who wants, we'll figure out who goes first. Whoever goes first gets to pick the category. If they get it wrong, we'll go to the next group. If they get it wrong, we'll go to the next group. If all three people get it wrong, nobody gets the points. It is still minus points though, so keep that in mind. And then if they get that question correct, they get the points. We'll move on to the next team, and then we'll go from there. Okay? Make sense?
I really miss those buzzers though.
I still have them up there somewhere. Who wants to go first?
Let the end begin.
Yeah, they're the first one.
All right. The end?
Burns for 1,200, please.
Burns for 1200.
Oh, I mean, if you scared, go to church.
Hey, we can pray real quick when we need to now.
No, I can't. Now, you're not gonna let right here over you. I already knew you.
All right, this is only the ends question until they get it wrong, okay? Yep.
Okay.
A 100-kilogram patient with 50% total body surface area burns arrived at the hospital 3 hours after the injury occurred using the Parkulin formula that's right there. What rate should the nurse set the infusion pump to deliver the first half of the fluid resuscitation on time? That is a mouthful.
Is this a timer or?
You got 10 seconds.
I'm gonna say what is,
You can.
I think I
what
do
is
it wrong.
2,000?
She says, what is 2000?
And if it's wrong, then I guess I gotta pray.
Oh, I think it's.
Well, maybe we're not.
All right.
Oh,
Yeah, that's right.
What is 2,000 milliliters an hour? Did everybody get 2,000 milliliters an hour?
Spoiler alert, I don't know how to do that.
So remember, the first half of the fluid has got to be within the 8-hour time frame. But it said the initial injury occurred 3 hours ago. So that means I have 5 hours to get that first half amount of fluids in. So I'm going to divide that total volume in half, whatever that number was, and then I'm going to divide it by 5 to get 2,000 milliliters per hour, right?
yes.
Okay.
What?
1,200.
I can't smell it right now. I think my allergies are killing me.
Oh, God. What's in there?
I don't want to smell it. I'm gonna
Next
throw up.
team.
Oh, my God.
I'm so sensitive to
Oh, is
smells.
it not going to do it? It's not.
Fart smells good.
It's because I don't have it downloaded.
Well, I'll write it down.
Oh, I got it now.
Yeah, that's fine.
Yeah, to be honest with you,
What we have done.
It tastes amazing.
good for you.
All right, Cybertrucks, you're next.
All right.
It's not disappearing because I have it online instead of downloaded.
I studied
That's okay.
aneurysms today. If y'all want to do
If you
aneurysms.
put this, can you see the screen up, and then you can take a Sharpie and mark it
Well, he's got them all up on the
off. All
wall.
but the top 2 rows.
Well, I was gonna write it down.
Okay.
Yeah, that works.
Oh, snap.
Look at Chuck.
Solving problems.
We're only allowed to answer from 600
Could
down.
just draw on the screen.
So you wanna write on the wall?
But you keep track of the top 2 rows.
All right, Cybertrucks, what you got?
I studied aneurysms today. If y'all want to do them. or-
Okay, yes, we do. For what?
Oh, they're picking.
For 1,200.
Aneurysms for 1,200. A patient with AAA suddenly reports severe back pain, has a rapid weak pulse, and a pale, cool skin.
It's a
What are
rush.
the nursing's priority action?
B, or what is, how do you say this? What is B?
What?
What is B? Okay. Yes, correct.
That was pretty easy, 3 hours.
I mean,
Hopefully the test just like this too, though.
Are you supposed to say what is?
what is B? Notify the provider immediately. Suspected rupture. Okay.
I studied this in depth today. so-
Good job.
Also, there was a lot of questions on
You
the
can
email.
barely
about
see
this.
this recording.
Don't be judging me now.
But I'm also keeping track of my paper, I told you. There you go.
All right, girls, what you got? I feel like we have to improve your name. I don't like the girls sometimes.
What did TDI for 1200?
TBI for
Go big or go home.
Patient with a traumatic brain injury has a Glasgow coma score of 7 and has been unconscious for over 8 hours. How would this TBI be classified?
What is severe?
What is severe? Correct.
I'm not studying TDIs.
Okay, everybody's going to 1200, okay. Nobody's scared to go to church.
All right. What's your name? The end.
Triage, 1200.
That's a toughie.
Well, that's what Drew said.
Okay, according to the START triage method, how would you categorize a patient in a mass casualty scene who is unable to walk, has a respiratory rate of 25 breaths a minute, capillary refill of less than 2 seconds, and is able to follow simple commands? Don't be cheating and looking at you. Notice
I'm
it.
using my resources. I don't remember honestly where it's at.
So they're unable to walk, so they're unable to walk. Yes.
I did this today.
But they're able to follow some commands, so.
Ellen came and studied with me, actually, I studied, well, showing her
What is
yesterday.
yellow?
What is yellow? Okay. What's the other term for it?
Excuse me?
Yellow or what?
Delayed.
Yellow or delayed? Okay.
I hope that's it, or.
That is it. Are you not gonna give us just the colors?
Who knows what I might do? Okay. So respiratory rate was 25. They were unable to walk, but they were able to follow commands. That's the key there at the end. And the cap refill was less than 2 seconds. But able to follow commands. If they weren't unable to follow commands,
Red.
be red, right? Okay.
Urgent.
Urgent.
I think, yeah.
And then emergent is, no, is it,
Expected.
what is red?
Expected is dead, or
Red.
black, or gray.
So red is,
Emergent?
Emergent.
And then yellow is delayed.
red is over 30 respirations, over 3 cap refill.
Or no red.
Unable to follow commands, right? Okay. I didn't follow that little chart you gave.
Okay. Cybertrucks.
What do you ask me? No, aneurysms were triaged, I don't know old content.
Not you don't know old content.
You do know old content, because it's old content.
I don't know, I'm more confident what I learned today.
Old content for 1200.
Old content. It could be an easy 1200 old content, right?
Zach said he goes to church and he's not scared.
Okay, yeah,
Oh, God.
okay.
Trauma patient arrives with internal bleeding. ABG results are as follows: pH 7.26, CO2 of 28, bicarb of 12. How would the nurse interpret this?
Okay, it's respiratory,
It's,
it's
that's,
respiratory equal.
it's,
No, it's
it would be,
respiratory equal.
because, no, respiratory
Opposite.
run, yeah,
So
so it's
metabolic
metabolic And it's uncompensated, it's HCO3 is low.
Partially, it's
So we're
partially.
saying uncompensated?
It was partially compensated.
But how is
Partially
it partially
compensated,
compensated?
because both ABG values are different. If only one ABG value is different, it would be uncompensated.
That
It is on.
But it's,
it's uncompensated?
it's on compass.
Okay, we're,
Wait, it's partially compensated. It's partially because both
HCO3 is
ABG.
low.
Cause both of them are.
Low, it's, yeah, partially.
Okay.
Cybertruck's final answer?
Wait, well, partially compensated
What is,
metabolic acidosis.
Partially compensated metabolic acidosis?
I hope so.
Okay, that's correct. Good.
But she didn't
Ooh.
say.
I'm sorry, Zach, I knew it. That's the reason I said it. Partially
I remember
uncompensated is if one ABG is normal.
It's always.
So if that HCO3 would have been 24, it would have been uncompensated. Or, I'm sorry, if the respiratory would have been 40,
Okay,
then it would have
so
hallelujah for you.
pH 7.26, high or low?
been low.
Low, okay, good.
Well, look, we forgot I was out there.
CO2, 28,
Low.
low, okay, good. Bicarb, low is 12. Alright, remember, respiratory is opposite. So if my pH is low, my CO2's gotta be high to be respiratory related. That's not the case. So I move on to my bicarb. pH is low, bicarb is low. That's 2 equals. So metabolic. pH is alkalotic or acidotic? Acidotic, good. So metabolic acidosis. Now, is my CO2 level changing to help out my pH? Yes, because it is low, right? 35 to 45.
I see where I'm at.
Right? The lower my CO2 level goes, the more alkalotic I get. It's trying to get more alkalotic to help buffer this pH to get it back in normal range. Is it in normal range right now?
No.
No. So that's why it's partially compensated. Now, if my pH was back in range, I still had these 2 abnormal values, then I could say fully compensated metabolic acidosis. Okay?
Look at you saying that.
I don't know, because I said respiratory equal because I was thinking backwards.
We're all.
Don't ever listen to me.
I'm sorry, Zach, I
That's
just knew
awesome.
it.
That's awesome.
I felt bad because I was like, no, it is.
I'm so glad. I about let us down the wrong path.
We are all working parts of a well-oiled Cybertruck.
All right, girls, what you got? Old content for 1,000.
I love the boldness to say y'all.
A patient with septic shock remains hypotensive despite IV fluids. Which medication is recommended as a first-line vasopressor therapy?
What is D?
What is D? Norepinephrine. You would be correct. Good job.
I said it.
All of these are vasopressors. First-line treatment for septic shock, at least, without IV fluids is going to be norepinephrine. We gave the IV fluids, still hypotensive. I got to get something else on board. Okay.
What would you go to next?
Usually, you're going to go with neo or vaso.
Okay.
Dopamine is going to be your last line. They're actually coming out with a new one, methylene blue therapy. And I have not fully researched that to even tell you the least about it. So
Works on the nitrous oxide pathway.
there you
Then there's phases. Then
go.
there's
So yeah, I haven't fully researched that yet, but methylene blue very similar to what you take that makes you pee blue and all that kind of stuff. Yep. All right. Gotta get your points.
Burns for 1,000.
Burns for 1,000.
I gotta do my ABG ninja.
Are y'all missing the point? Someone?
Us?
we'll get three, then they'll get three, then
Yeah,
it goes.
that
No,
works.
I can more so bossy, I feel
Burns for 1,000.
Yes, please.
75 kilo patient, sustained 40% total body surface area of burns. Use the Parkland formula. What is the total volume of fluid to be administered in the first 8 hours of the injury?
What is 6,000?
I hear, what is 6,000? Can you be more specific?
What is 6,000?
Milliliters, good. What is 6,000 milliliters? Okay.
We could just go ahead and take place.
Cybertrucks?
Triage?
Yeah,
For
since
1,000?
you studied it, you're the one who studied it.
Triage for 1,000?
Yeah.
Yeah.
That's what
Triage for 1,000, okay.
Put you on the spot.
Using the STAR triage method, how would you categorize a patient who cannot walk, has a respiratory rate of 22, cat refill of 1 second, but is unable to follow commands? We just talked about it.
What is red emergent?
I hear, what is red emergent?
Okay.
Good.
Right.
Remember that key there, unable to follow commands, that automatically makes them emergent.
We did my house maybe actually productive today. I'm glad.
Right? Cause we all started out at the bottom and at the top.
Who's next? Girls?
What is TBI?
TBI 1,000? The end's gonna go real quick. What is the body's first compensatory mechanism to manage rising intracranial pressure?
What is A?
What is A? Displacement of CSF into the spinal canal.
That is correct, good job. Oh, I wasn't gonna say that, sorry. Is that TBI?
I need to study TBI really bad.
Then,
Aneurysms for 1,000, please, that's all that's left.
which finding differentiates a true aneurysm from a false aneurysm? So select all that apply.
Wait a minute now. This is not fair because the other ones was not select all that applied, but it's okay.
You chose it, so you didn't have to choose aneurysm 1,000.
You are right. Oh, Lord have mercy.
Don't be cheating over there.
Do we get partial points if we get saved?
You do not get partial points.
You'll probably see better. Megan,
What is C and D?
What is C and D?
We're not sure.
I'm hearing, what is C and D? That would be correct.
oh, look at us.
Go guys.
Because
All right, true aneurysm, right? Weakening of the 3 arterial walls, causing that ballooning effect of your saccular or your falciform. Your false aneurysm, some type of trauma, penetrating trauma usually a gunshot wound, knife wound, something along those lines, okay?
I knew it was D, but then that was
I was thinking B for
Look like a toddler just went up there drawing.
you should draw smiling faces.
Cybertruck.
What do you want to do? Triage for 800.
Triage for 800.
The last aneurysm one scared me.
Yeah, no kidding. I'm not even nervous.
Patient arrives at the emergency department with a simple, non-displaced fracture of the radius. According to the 3-tiered hospital triage system, which category is most appropriate?
I think it is yellow. It's not red, and green is not green. I don't think it is green, because green means you don't think there's gonna be further deterioration, and there could be further deterioration. I think it's
They
green.
can wait. It's great. I think it's great.
Okay. What is green?
That'll be incorrect.
I'm sorry, guys.
Can we still?
What you got?
What is yellow?
Be incorrect.
What?
What, is it a color?
It's, I'm gonna say, is it tier 4? What is tier 4?
What is tier 4? Are you all right? Hold on.
You be, wait a second.
No, it's not, it's a hospital, it's the.
Oh, according to the hospital.
This
Oh,
says
well, they
3
better not go to
tiers.
Union
I
Springs.
thought there was four tiers.
I thought there was 4 too.
That's the reason I didn't answer that. It's supposed to be-
I feel like we need more information.
Request more information.
You
Yeah,
can't say
request
that
more
again.
information.
You cannot say request more.
You can request something.
No.
Non-underrated.
Meg and Drew, let's.
Y'all
converse.
want to
Still the
answer?
wrong person.
No, it's tier
Like,
3.
I think the levels
Tier
were.
3.
Now, who, Mr. McCarty? Where is that?
Non-urgent.
Really? That's.
Well, they say
non-urgent.
That's not in the mass casualty triage
It's not
category.
urgent?
That's a
It's
green
the
tag.
hospital
It's a green tag,
triage
not
system, hospital triage.
Chuck, you said.
I don't like that.
What's the triage?
It's green, non-urgent.
That's
Delayed,
That was a trick
non-urgent
question.
That's on net.
Okay, but you got it right, so I'm glad I went with y'all, because I was.
I mean-
the same as regular green?
Let me double confirm.
Is it emergency?
Please,
or is
because
it,
Wait.
green is non-urgent, yellow is delayed, red is immediate, black is.
And for the record, we said green first.
Yes, they did say green. So I feel like green and non-urgent is the same thing. That's how I learned it.
Me too, I think.
I mean, they walkie-talkie, they can wait.
Right.
So if non-urgent, could wait several hours if needed without fear of deterioration.
Green.
That's green.
That's green.
Urgent, needs quick treatment, but not immediate life-threatening or emergent, life-threatening.
Yellow.
Nope, it's different, okay?
It's
Please
the
don't
same
put that on the test.
concept,
It's the same concept, but it's not quite the
you
same.
know,
So you have delayed,
we're gonna vote to throw this question out.
We all, it doesn't make a difference because we all missed it.
That is,
That means that we,
let's see. I feel like that could be confusing, honestly.
It is very confusing.
yes.
What if happens in a real life if one person's using a triage system of this and the other's using green, yellow, red, and now you got patients everywhere that are, some are urgent, some are not urgent, some are expecting. Yeah, I mean,
So are we all getting eight?
Yeah, we-
We all get it.
I like that about you.
I did not know that.
please throw the question out.
A democracy, I love to see it.
It's actually
All right.
socialism.
Socialism.
Wait,
Just give everybody
Let's
a.
not get into that.
Yo, I kind of feel like if we could do this for, after our test for our questions, we get a lot of
What is the
answers
other
back.
one?
I
A
know.
meeting.
What is the other, like
It's-
other triage?
It's the START triage or, trauma triage, which in my notes, looking back, I did say emergent, urgent. The other tag system though in the picture is delayed, immediate, or minor, so,
Oh, I did see that picture today.
yeah.
So do we need to pay attention to which, like in the test for future reference?
It'll be,
So we need to know like hospital triage or trauma triage.
I doubt hospital triage is gonna be there, if we're being honest.
Because, I mean, you have trauma in the hospital.
So
but it's trauma before the hospital. You're triaging before. So any kind of natural disaster, we did
Should be disaster.
bus crash or parking deck crash, because Sam's gonna die last because she parks on the second floor.
Me and Sam are together.
So-
Sam never follows the.
Who paid that question?
We did.
Y'all did? So, girls in the back?
Wait a minute, how's that work if we all got points for it though?
Yeah, did we get another question?
At least we don't get minuses.
It doesn't, yeah, it doesn't.
You didn't have to bring it up.
Okay.
Girls, what you choosing?
I think TBI for 800.
TBI for 800, okay.
Let's give us one last.
It does give us.
District party, we got one last question then, if everybody got that one. Like, they have 5 and we have 4.
It'll add up in the end. We're not winning anything, so.
It doesn't matter to us.
We are too competitive.
Well, obviously.
Looking back, I probably could have made this one a 1200, but that's okay. Which vital sign change makes up Cushing's triage? Triad, there we go. Man, Cushing's triad, a late indicator of ICP, increased intracranial pressure.
Yeah, I think that's right.
Girls? Would it be temperature?
Yeah.
Is that your final answer?
Systemic nerve. I don't know.
What's your final answer?
Temperature.
Would you like to answer?
Widening pulse pressure,
Okay.
bradycardia, and hypertension.
Hypertension, perfect.
Good job, guys.
So that was,
And hypertension.
Severe hypertension, widening pulse pressure, so your systolic and diastolic have a big range, and bradycardia. Okay.
See, I belong to ICP.
Mm.
you're our team leader.
Do we,
Oh, yeah, I think it's.
did they go again?
Sergeant Trucks?
Oh, okay. Let's do Burns for 800. Sorry.
No, that's got okay.
According to the rule of nines, for an adult, what is the total body surface area? It's okay, I promise. Burn, if a patient has burns covering their entire back and the entire front of the right arm.
Oh, the right one.
Alright. You got it.
Oh, okay. What is 22.5%?
22.5%. Good job.
Oh, the front one.
Posterior trunk, entire back, which is what?
18.
18%. Entire front, anterior of the right arm, not the entire
Yeah.
arm. Okay, so that might throw you off a
I
little
did the
bit.
same thing.
Entire front, that's only 4.5, right? Okay.
Thanks for saving me on that one.
Girls?
Old content for
Old content for 800. Okay, interpret what this rhythm is. pot? Okay. What's the other term for it?
Just move it,
Mobus one, okay. What's the other name for it?
type, I don't know. Third,
Yes.
Second degree.
Second degree type
Maybe.
1. Okay. Longer drop, that's a winky pot, good. So, everybody see your PR animal? Pretty short right here, right? A little bit longer, a little bit longer. Then I have a P wave, no QRS complex, and then I go back into my normal cycle. What you got at the end?
Well, go ahead, man, speak up, girl.
Aneurysms. Which assessment finding is most characteristic of an abdominal aortic aneurysm, or AAA?
What is B?
What is B? Good. Pulsating mass in the left upper quadrant. Cybertrucks?
I think last time.
Aneurysms for 600.
Aneurysms for 600. 70-year-old male with a history of smoking is undergoing a one-time ultrasound screening. According to the guidelines presented, what condition is this screening primarily intended to detect?
That's not fair, there's a lab tech on there. X-rays on there.
Is that right?
Yeah.
What is AAA, abdominal aortic aneurysm?
Good job.
I think it's something that was looked up before.
Girls?
Old concept.
I like the whole concept. Another algorithm.
That was the NCLEX for me, y'all.
Please interpret.
What is a third degree blood?
What is a third-degree block? Good job, guys. So in that rhythm, the P waves were acting independently, QRS waves were not acting with the P waves. Right? Atrium and your ventricles beating on their own, they don't care what the other one is doing, okay? Perfect. Then what you got?
Burn 600, please.
Burn 600. Fucking need that a lot. When treating a patient with a chemical burn from a dry powder, what is the initial and most appropriate action?
I feel like this is kind of a trick question.
Yeah.
I don't like that.
It's either
Well, see, that's where you can put the what if in the
It
situation.
right is like,
Oh,
don't read into
What
the
if there-
question. Ms. McCarty, I feel like this
I
needs to
was
be thrown
thinking,
out.
what is the?
Already has the word.
Right, when treating a patient with a chemical burn,
If I stand directly over him, then it's pouring on me and not him, and now he's not got it on it, and I can dust it off.
I like that. I like that a lot.
Are we still with the chemicals?
I'm gonna remove the patient from the source.
Okay,
Oh,
Summer Strokes?
what is the,
Ain't that what we said?
I wanted to say it was.
well, if he's come into the hospital with the burn, then he's already had the burn.
Yes, that's the.
I don't.
See, that's why I get confused, like.
Mr. McCarty,
It's
Mr.
not actually
McCarty,
on.
that is not fair. It's not fair, because if Mister is inside that chemical plant,
Did I say he was in the chemical?
it don't matter what you said.
It's very
You ain't say where he was at.
You're reading into the question too much.
We
What's
just
my
did
priority?
triage, what is it always, make sure the scene is safe and remove the patient.
Safe was not safe.
I can't create in-cuss questions, I'm gonna argue them down every time.
Was that burn 600?
So minus 600.
Girls?
Oh, do we don't?
No, you already answered. You're good.
Oh, because we answered the last one.
One problem that I have is that the final Jeopardy question doesn't work.
I mean, it didn't last one.
Yes, all the TBIs. I hate TBI questions.
What you got? You don't want old content again?
I did, we did that, Stephanie does.
Stephanie wants triage for 600?
We did the all 600 ones, and I'm trying to see.
Yeah, TBI.
TBI.
Take that.
We always do TBI, that one messes us up.
You
There's-
take that TBI 600.
There's triage and TBI for 600.
Y'all choose. You go, you go.
TBI.
Triage 600, all right. Which key feature distinguishes a level 1 trauma center from a lower level trauma center, according to the provided material? I didn't read that part out, let's go. To the trauma center.
I did this.
B, good. Stabilize and provide through all stages of care. Remember, level 1 can do anything, all right? They don't have to outsource anything at all.
Mayo Clinic, because that's what you see for
All right, the end?
The last 600 category, please.
Good.
With no trick question.
They had us list all answer questions, that's not.
Right.
Patient with a traumatic brain injury briefly lost consciousness at the scene, was then alert for about an hour and is now rapidly deteriorating. This presentation with a lucid interval is a hallmark sign of what condition?
Y'all know? No? What is C?
All right, good.
I was gonna say, please don't play with me, because I had to study that.
Epidural hematoma.
I didn't know that.
I remember when you're, not very lucid, you never epidural. That's how I remember
What
that.
do you want me to do?
Yeah, the baby's taking.
Dude, whole content.
Nope, already did it. Good, good.
All content?
Yeah.
All what it, all,
You should be very proud of us, you've taught us a lot.
Seems like it, I hope.
all content for 400.
Y'all are stuck with me for one more semester.
As long as we're not learning nothing new.
Old content, what is the primary characteristic of SIMV mode?
Oh.
Okay, wait. This is the same thing as the assist control, right? Okay, so. Oh, yeah, I think it's.
The top one says all breaths are mandatory and ventilator controlled.
No. Wait, I'm sorry. I think it's C. Is SIMV?
No, I think it's B.
Is SIMV the same thing as the,
I was late.
That's where he can breathe above and beyond.
I was late.
Alright, Cyber trucks,
Yes.
oh, what is B?
what is B? You'd be correct. Good. So let's talk about it, since y'all had a couple of questions. Assist control. That's your top tier setting, the most severe that you're gonna learn in nursing school. When you get out into the real world, there's a lot more fancy stuff out there that you can learn if you want to. But assist control, I have a set rate and I have a set tidal volume. So let's say my set respiratory rate is gonna be 20. So my ventilator is going to give my patient 20 breaths every minute. It also has that set tidal volume. So let's say tidal volume of 450. So for those 20 breaths, he's gonna get a tidal volume of 450. Now, if my patient overbreathes the vent because he's agitated or anxious or something like that, so let's say he's breathing 22 times a minute, those 2 extra breaths, he's also gonna get a tidal volume of 450, all right? Next tier down, so this SIMV setting right here. Set rate, set tidal volume. But here's the difference. When he breathes those 2 extra breaths over the mandatory 20 breaths per minute, it's whatever he wants to do. It's whatever tidal volume he wants to pull. So if he wants to pull 150 tidal volume, the ventilator will let him do that. The reason we do this is because we're trying to wean our patient off the ventilator. So this is kind of that middle option. Trying to let our lungs recover a little bit, strengthen them up a little bit, because our lungs have gotten lazy from being on ventilator support for a long period of time. All right, so trying to get them a little mini workout, making sure they can tolerate being off the ventilator, getting used to kind of breathing on their own a little bit. That's why we have SIMV. The last setting is that CPAP mode, where they do all the work for them. The ventilator doesn't do any of the work. The patient does all the work themselves. We give them just a touch of pressure, just a little bit to kind of open up their lungs, because they are breathing through a straw, basically. So, okay. Questions about that?
I thought it was the first one, the second one. That makes sense. I'm glad y'all make sense.
Drugs. Girls.
Birds for 400.
Burns for 400. In a burn wound, what is the primary goal of treatment for the zone of stasis?
What is B?
To reverse ischemia and increase tissue perfusion. Good. Remember zone of stasis, that's where that clot formation is. I don't have good perfusion to that area. So with that increased fluid that I'm trying to infuse into them for that Parkland formula, my main goal is to increase that total fluid volume, increase that tissue perfusion. In?
Old content for 400.
Have we already done that?
Yes.
Just did that one.
Huh?
We just did that one.
We did old content and burn.
You got triage, TBI, or aneurysms? Or any of the 200?
Triage for 400, please.
Triage for 400.
DVI.
That's all right. What you got?
That's not how the game works.
It's forcing your hand.
Patient with a high level spinal cord injury suddenly develops I can't go back. So suddenly develops a burning headache, profound sweating on their face and neck, and a blood pressure of 210 over 120.
What is A?
Yep, good.
I know that answer.
All right, what is my patient experiencing?
That pressure thing.
That pressure thing, what's that pressure thing called?
I don't know.
I heard reflexia. What's the term before it though?
So,
Autonomic? Yeah, autonomic dysreflexia, right? Good. So in autonomic dysreflexia, there's some type of stimuli that's causing this to occur, whether that be a fecal impaction, urinary retention, Maybe there's a pressure wound, or maybe their like leg is laying up against the side rail, causing that stimuli. Maybe there's a wrinkle in the sheets.
Tight clothes.
Tight clothing, good. So there's some reason or another that's causing this reflex to occur. Number one priority though, first things first, raise the head of that bed, decreasing that intracranial pressure. After that, I can do some of this other stuff. Administer that IV beta blocker. Drive that blood pressure down. We're in a dangerous level right now. We're at 210 over 120. After that, then I can check for the cause, whether it be a fecal impaction, urinary retention, something like that. After I do all this stuff, then I can say, hey doc, this is what I did. Okay? Doc doesn't care because he's already giving you the orders to do all this stuff. All right? He's gonna get mad at you because he wants you to do this stuff first. All right?
Triage or aneurysms?
Y'all want triage reform?
Triage or aneurysms? That sounds good.
Triage reform?
You're okay. Godspeed.
Either way, I didn't care.
All right. During a hospital's mass casualty response, which role is responsible for leading the overall response and coordinating all emergency activities?
I wrote this down today, it's commander something. Oh, I wrote it down today, it's commander, chief commander,
See, did y'all want this one?
Nope, thank you.
chief commander officer,
Appreciate that.
chief commander officer, something like that. I wrote it down today.
It's the CEO usually.
Chief, it's usually the head of surgeon or the head
That's the other-
physician.
That's the other guy.
Okay.
I
Can you be more specific?
What is the chief commander officer?
No.
Would y'all like to answer? No?
Wait, why are we not interested?
It's the incident commander.
It's tell, don't worry.
It's the first one.
Okay, good.
I thought you said no.
Say the IC.
Incident commander, is that what you're going with?
Yes.
Okay.
Am I right or wrong?
No.
Now that it's over, I'm looking at it.
Well,
Well,
if
we
we're
got-
playing by Jeopardy rules, how about this?
Excuse me?
There's a word for it.
What is?
No. It's
I have no idea.
Right, I need to-
Got so long ago, right?
Hospital incident
Mr.
commander.
McCarty, come on.
Wow, that's
I said it's-
a 1200 question right there.
Yeah.
Are you looking up your notes?
I am, it's the hospital incident commander, it's usually your head physician, chief of surgeon, leads and coordinates.
Was I saying?
No, you're right, I wanna know what it was. I
So-
was looking for my own benefit.
Do we all get 400?
No.
What?
You answered the question. You said incident commander. Y'all are the only ones that said no, right? Yeah. There you go. Okay. You wanted this question originally anyway, right?
You know what? This is not the music that we are used to. I'm gonna call Courtney.
Ruthless. I guess y'all got it wrong. Y'all, we'll do girls. How about that?
Making it up as you go.
I cannot believe this.
What is aneurysms?
I need a drink.
Aneurysms for 400. That's all my 400, right?
Yes. Aneurysm's the last one.
Patient arrives in the emergency department describing a sudden, severe tearing and ripping pain in their back that is moving toward their abdomen. These symptoms are characteristic of which vascular emergency?
What is it? TAA?
TAA? The end?
Drew, what's the answer?
What is an A40 dissection?
Good.
There we go.
Mm-hmm.
I think the tearing and ripping, is that right?
Yeah, they usually die too.
Well, not here,
Sometimes there's a 99% that she's sitting in CV.
All right, now we have all 200s.
Cybertrucks,
All right,
200s.
Old content?
all
Sounds
kinds.
good to me.
Y'all gonna be happy about this one, hopefully.
Yeah,
Oh, Lord.
Okay, wait, left atrium and left ventricle is the, hold on. I think it's
You
the
can,
Is it the mitral?
mitral.
It is.
There's
just
also,
gotta try it before you buy. Buy. There's another name for it, but that's how I remember.
what is it, the
It's,
mitral?
I think it's mitral. I'm pretty sure, cause that's when,
I don't know.
mitral valve prolapse is when the ventricle contracts and you get the prolapse in it, so I think it's mitral valve.
Alright, go ahead.
Yeah. Alright, what is mitral valve?
Correct.
You always have, I always have to like picture the heart.
Backwards?
Like, yeah, right, cause left on this side.
Oh wait, I could have literally have done the,
I just remember
Much.
the mitral valve and left are both short.
I didn't think about that, but
And
yeah.
right.
If you said bicuspid, leave it correct as well, right?
Yeah.
Yeah,
I didn't know that was what it's called.
I just
Chuck,
always
you're just so
remember
smart, I just have to like,
mitral valve is a smaller word and left is a smaller word, right and tricuspid go together.
We got burns, triage, TBI, and aneurysms.
What you going for, girls?
200s.
TBI for 200.
All right.
Football player is injured by direct blow to the head, causing a sudden acceleration and deceleration. This mechanism is an example of which type of spinal cord injury?
this is the one I couldn't do. I was watching a car wreck on TV and all these things that I didn't class.
I feel like these might be harder for some of the 1200 questions.
Say that again?
What's deep?
Good. Hyperextension.
That's the one that I can't do, yeah.
So whiplash.
Yeah, whiplash. The key there, acceleration, moving forward, deceleration. All right, coming back.
Stay in a car wreck.
I'm never gonna forget that. Trying to.
You got 40 minutes.
Burns for 200, please.
Burn injury extends through the entire epidermis and dermis and into the upper layers of the subcutaneous tissue.
It's not, it's not, it's not. No, you're not. Cause I just thought about that picture in my head.
Say, what is the partial thickness burn?
Partial thickness, you know the name for it?
A third degree burn?
Full thickness burns. Deep full thickness is down into the bones, into the muscle tendons, that kind of stuff. Okay.
Partial thickness is only through the first and part into the second.
What do we have left? Yeah, aneurysms.
What do we have left?
We have triage and aneurysm.
Triage and aneurysms for 200.
Aneurysms for 200.
Aneurysm for 200. So girls, y'all have triage for 200. You said aneurysm 200, right?
Mhm.
Patient diagnostic imaging reveals a diffuse dilation affecting the entire circumference of the abdominal aorta. How is this type of aneurysm best described?
Fusiform, what is a fusiform aneurysm? I drew it today, the other one. Looks like
You drew it
it's,
today.
I did, the other one looks like it's having a baby.
Fuse form, and then S is just one side.
Triage 200. That's all they left.
Finish strong.
During a hospital's disaster response, which individual is primarily responsible for managing all communication with the media and external agencies?
Do you know it?
I'm not really used to calling it law enforcement, but I don't know if it's the same thing. Probably is. Similar.
I don't know it. I need my sheet, but I can't get that other sheet.
Can we say who does it?
Who doesn't? Who does it?
Who carries it? It's,
I'm gonna let you say that, because I don't know it.
what is, what is it Officer of Public Relations?
Should we accept that?
No.
No, because we didn't accept. If it's
Yeah,
not-
exactly.
If it's the Hospital Officer of Public Relations.
If it's not, it better be exactly what he said. He didn't show us no mercy.
What? If I have all the words in the wrong order.
Are y'all gonna answer? No.
Chuck is.
Relations officer.
Public relations officer?
That ain't it either.
What?
I need to look
That's
at it.
why we didn't answer.
Public information.
Oh my.
officer.
Do you know how disappointed I am in myself? I
Yes, it is the same thing, but not what this says. According to Jeopardy. You
I
gotta be
have a
close.
whole chart and I remember none
Wait,
of
you're
writing
close.
it.
Yeah,
I
you're
thought
good.
it was a really great.
We obviously need to look into that. These are definitely gonna be.
I'll send you all a picture of my notes because I did not send them. But
Don't give away Final Jeopardy like you did last time.
I'm kinda mad about that. But-
Alright.
Alright. Before you answer, the end, what do you wanna wager?
Hold, please, we're in.
You're gonna tally up?
Yeah, we're done.
Cybertruck, tally up for me.
1400.
Can y'all see that?
Yeah.
And then the girls tally up as well.
Okay.
Please don't cheat, okay? Let's show some integrity and professionalism.
6,200. Is it 6,400?
800 plus 800 plus 600. 600. Minus 400.
I need to see how much that's.
200. 1,500, is that what y'all got?
Sure. Sounds good.
I got 58.
Yeah,
All
okay.
right,
Yeah, yeah, yeah. I forgot to do the minus 600.
we want to wager 5,800. Just
Yeah,
kidding.
yeah, let's wait.
5,790.
$99.
What is that?
Someone's gonna do the
What's y'all's total?
5,800. If I did the math right.
What's y'all's total?
8,000.
How are we so low?
I didn't purposely cheat if I rounded it up wrong.
Count right?
No.
Who, what?
No, us, cause they got something more than y'all. I think we just, that's 4,600. Oh, it's 4,600. Wait, 5,200 is ours.
Okay.
How?
52. They skipped a lot and then people
Oh,
skipped
we
a
skipped
lot.
one.
Yeah.
Oh, yeah.
So 5,200? Alright. Then how much y'all wanna wager?
Well, we'll see how much Americans vote in first.
Y'all went first, so we go first. And you have the higher total. Or do you wanna write your wager down?
Yeah.
Alright, write your wager down.
All right. I'll look for $2.
We gotta give it to you now.
No, just write your wager down.
98, okay.
And then Final Jeopardy. Here's your ABG results. pH 7.25, CO2 of 60, bicarb of 24, PaO2 of 88, Your FiO2 is 40. Come on. Ventilator mode is assist control, rate of 12, tidal volume 500, PEEP of 5. All right, you're gonna write down your answer and then you'll turn it in. What ventilator setting adjustment is indicated, and tell me why. Why are you going to do that?
Our total is wrong. We only have 4,600. Because those last three cancel out.
You know, we didn't have to correct.
Is that right?
Well, no, that's not what we have. Okay. You're on it. Yes.
I'm like so disappointed in myself for not remembering my whole chart that I made on these rolls.
So write your wager down first, and then write down your answer, and tell me why. Why are you gonna do that?
Somebody writing it down. Writing it down.
Oh, I thought Chuck wrote it down. I didn't have it. You can. I can write it.
What's our wager?
Do you write the answer on there too? I can take it.
Plus or minus?
Oh, come on now.
No,
You can't.
Stop there.
That's your weight.
Can we go ahead and get it in plus or minus?
That's your wager. What you got?
Wait, but I already prepared my answer.
What's your wager?
5,798.
Yes.
Yes.
5,798.
Good.
Yes.
Girls?
Wagering $2.
Are y'all gonna answer? No, you're not answering?
Yes.
Oh, okay.
Plus or minus $2. That's smart, honestly.
Honestly, yeah.
If everybody else gets it wrong, then you're good.
On that,
Yeah.
we might be able to put a down payment on that cyber truck.
But we're all gonna share.
Huh?
So we're all gonna share.
I mean, it's just gonna be three of us sharing.
All right. Let's read the question again. So, here's our ABG readings. ABG, pH 7.25, CO2 of 60, bicarb 24, PaO2 of 88 with 40% FiO2. Here's your current ventilator setting. Sys control, rate of 12, tidal volume 500, PEEP of 5. What ventilator setting adjustment is indicated and why? So your correct answer is going to be increase your respiratory rate. Okay?
That's what we said.
All right, but why? That's the
Because
question.
you're respiratory acidotic and you need to blow off more CO2.
So everybody put blow off more CO2, which is correct again. Like Anna said, we are in respiratory acidosis, right? Our pH is real low. Well, not real low, but it's low. CO2 of 60, which is high. Our bicarb right here is 24, so that's not really compensating at all, right? 22 to 26 is our normal range, so I really can't count on my bicarb currently. So I gotta tell my ventilator, hey, I need to try to fix something. The only way to fix low pH, high CO2, as far as ventilator adjustments go, is to increase my respiratory rate. So hopefully, as my CO2 decreases, my pH should increase, getting it back into normal range. I'm trying to trick the body to getting back to its normal self. That's my end goal right there. All right, does that make sense? Then I could also ask you what type of mode we put it in. Should I put it in SIMV? Should I put it in CPAP mode? That kind of stuff. So there's lots of variations of that. Alright, 8,000 plus 4,000, that's what, 1,200? That's, how much is this?
11,598.
11,598, and we got 4,602. So, good job, Dan. Good job, guys.